folks. I'm Kevin McSorley. I'm head of Radius Connect 24. I'm also a non-exec director of TSA. And my first task today is to wish you a happy St. Patrick's Day. So I'm delighted to be here to bid you Céad Míle Fáilte to this session. All about enhancing our workforce strategies for building a stronger future. So it's always a learning event for me, this conference, and I'm looking forward to hearing more about what is happening at a national level and understanding more about the really big challenges that we're in front of us from a workforce perspective. Discussing how we might work together. You might hear the word collaborate a lot in this conference to mitigate the challenges and actually provide effective solutions. But we're not starting from a greenfield site. There's a lot already directly happening today. And if we work better together, collaboration is the key to making it happen. So we all know that the demand for adult social care services is increasing due to an aging population. And yet the sector struggles with its workforce challenges, high turnover rates, staff shortages, low pay, burnout. Our key workforce challenges facing the sector: recruitment, retention, sustainability. Now, a crucial element in addressing these challenges is technology-enabled care solutions. That includes remote monitoring and assistive devices, AI-powered care planning, and digital case management systems. They can all alleviate workforce pressures. They'll perhaps attract a new workforce, encourage digital-savvy professionals, with the aim of improving care quality, real-time data and insights for better decision-making, all for the purpose of supporting independence, allowing people to live those more independently with smart devices and telecare. And it'll also be more efficient, reducing those administrative burdens through automation and digital record keeping. The challenges for this sector is to ensure that tech is effectively implemented, integrated, and embraced by staff, while also securing funding, training, and the digital infrastructure necessary to support its adoption. That all requires a collaborative approach: government, local authorities, service care providers, technology developers. Now, to help us today to provide more insight into those challenges and how we can effectively work together to overcome any barriers, I would like to introduce you to our expert panel of speakers. No pressure, guys. So Jane Brightman will be first up. She's Director of Workforce Strategy for Skills for Care, and she leads on the implementation of the Adult Social Care Workforce Strategy for England, and was key in bringing this workforce strategy into fruition. 30 years of experience across the adult social care sector, frontline care, leadership, education, digital transformation, and national policy. Following Jane, we'll have Julie Stone, HE Consultant TSA Associate, who also has over 30 years experience. I'm so delighted that there are other people with over 30 years experience joining me today in the higher education sector. That's passionate about the quality design of work-based learning for impact. So Julie's supporting the workforce strategy approach within TSA and will elaborate on the sector co-design approach that underpins this. And last, but by no means least, because quality's there, Helen, we have Helen Loveday, Head of Quality and Improvement at Tech Quality at TSA. You've been here 4 years now on this journey. What a journey it's been, working with external stakeholders, promoting the QSF, the Quality Standards Framework, to the tech and the community equipment sector. Helen will very excitingly be sharing new developments within the framework which will support workforce upskilling. And at the end, there'll be a time for questions from the floor. So without further ado, I ask you to welcome Jane Brightman.
Thank you, Kevin. Hi, everybody. Great to be here. Quick disclaimer, this will be the least technological part of the day for you, I imagine, because I'm going to be talking workforce, but we'll throw some digital stuff in for you. So we're here to talk about the adult social care workforce strategy for England specifically. Just a quick, very quick update on who we are as Skills for Care. We have deep expertise in the workforce standards, skills and data in adult social care in England. We work really closely with our colleagues across the other nations. We have a strong brand, a strong infrastructure, and that extensive data that we carry out about the workforce that we collect every year. But what I'm here to talk to you about today is the adult social care workforce. We have a workforce of 1.5 million in adult social care, so that's 5.4% of all jobs in England. You can see there's some stats about the posts that are filled at the moment, but what you can see there is 131,000 vacancies on any given day. And we have 540,000 new posts that we're going to need by 2040. So that's a 29% increase in our workforce, something that's probably impossible. So we're going to need some more technology and some more data to help us get there. So a little bit on workforce demographics for you. We have 21% of our workforce is male. That's up this year, which is great. We employ more men than the British Army. So that's quite a big statistic. 75% of our workforce is British. And we have an average age of 44 in adult social care in England. £11 is a care worker's median hourly pay. That's a 10 pence differential for 5 years more or more experience. I mean, let's just let that sink in. It's not good. More than 80% of other jobs in our sectors pay more than adult social care. Qualifications, so 41% of our care workers have a relevant qualification at level 2 or above. And apprenticeships, which have traditionally been really well used in adult social care, are on a really significant decline. So you can see since 2016, 2017, down 75% on our use of apprenticeships in adult social care, and still declining at the moment. So why did we develop a workforce strategy? I think probably some of those statistics speak for themselves. We wanted to recognise the workforce that we have. We know that workforce makes a really important contribution, both value-wise and economically in the sector, and we needed to ensure that we were helping them to meet their timeliness, quality and effectiveness. We needed to be able to respond to the long-term position on recruitment and retention, and we needed to provide a set of proposals that could be owned by the government and the sector collectively. And in the context of lots and lots of reform, more than we even thought at the time, we needed to be able to make a really cost-effective contribution through the strategy. So how did we develop the strategy? So you can see there we did it in a very kind of truncated period of around 10 months, which is almost unheard of. And you can see we started in October in 2023, and we launched the strategy in July last year. I then had to lay in a very darkened room for about a week, and then we got straight back on with implementation from the August, which was great. We had a series of expert working groups. Probably the one you'd be most interested in is the Science, Technology, AI and Pharmaceuticals group, which was made up of experts across the sector. And we looked at how those areas could support us and where we could develop productivity and effectiveness across the sector. You can see there were lots of other groups there as well. We did a really important piece of work on economic modelling with Alma Economics. We did lots of engagement across the sector. We engaged with over 1,000 people and organisations from adult social care, including people with experience of drawing on care and support, workforce and employers, so people working on the front line as well, and the wider sector. I have to say, our wonderful co-chair, Sir David Pearson, is in the audience, and you may have heard of him. So we did quite a big piece of work on service assumptions, which David himself led. We looked at things like the Care Act, integrating health and care, reform of mental health, and demand for social care increasing. And we also looked at things like large increase in people who are working age adults drawing on adult social care, safeguarding concerns, how much more care needs to be delivered in the community, how direct payments have reduced quite significantly, and we looked at consistent feedback around prevention. Lots of people contributed to the workforce strategy, and this is just a few of those who sat on what we called the steering group when we were developing the workforce strategy, chaired by David and Professor Ona Smith, who's the CEO of Skills for Care. You can see there all of those organisations, but as I said, we had a lot of organisations who supported, in particular thanks to TSA, who engaged with us on not just the expert working groups, but right the way through developing the strategy, and we've continued that relationship with TSA, so really exciting. So let's whip through some examples of the recommendations and commitments. There's around 53 altogether. I won't bore you with all of them, but you can see we've broken them into 3 areas. So the first area is attract and retain. So we've looked at things like pay, terms and conditions, international recruitment, attraction, how we can work better with individual employers and their PAs, how we can attract more leaders into the sector, and particularly looked at our regulated professionals, and we've called those our small but mighty workforce. So we know how to engage with them. They make up a small percentage of the sector, about 6.5% of the workforce, but we know that when they have the right conditions, the right training, the right support, they make the biggest impact. And we looked at things like wellbeing and EDI. Then under the train bucket, we looked at things like career development, competencies. We worked really closely with CQC, who have actually made some commitments in the workforce strategy. We've looked at apprenticeships, which, as I said, are not great at the moment. We looked at more high quality training and funding for that training. And then we looked at our registered managers, so those people that manage care services, and we folded those into our small but mighty workforce as well. And then last but not least, transform, and this is where more of the technology and the digital and the data comes in. So we looked at things like workforce planning, how we can use more technology and data to do that, training infrastructure. We looked at how we can have a 10-year transformation plan. We looked at how we can engage people to either move away from coastal and rural areas or move into coastal and rural areas for work. New roles, and really excitingly, one of those new roles is the care technologist role, which I'll tell you a little bit more about in a minute. We looked specifically at digital skills of the workforce, and then we looked at things like registration, because as you'll probably know, the adult social care workforce isn't registered, so we're doing quite a big piece of research around that. And then we wanted to really focus strongly on how the workforce strategy can support the government's new missions and the free shifts. We obviously launched the strategy about a week into Labour's tenure, and so we've done quite a lot of kind of work looking at that across all of the recommendations and the 3 shifts in particular, and how we can help support that through the workforce strategy. We've been doing a lot of work influencing through the workforce strategy. So the steering group, as I described, have now become the oversight executive, still chaired by Sir David and Professor Ona Smith. And they continue to meet quarterly, and they're really using their influence as a group of senior leaders in the adult social care sector and across health and education as well. We've worked closely with the Minister for Care, and he has been making commitments about dementia, mandatory dementia training in Parliament, which is great. As I said, CQC have a strong advocacy for the workforce strategy. Social Work England have worked with us, and they've hosted a round table, and we have committed to some suggestions in the spending review that's coming up in the spring and sort of moving into 26-27, and we really want the workforce strategy to be considered as part of that. The workforce strategy now has a small implementation unit which sits in Skills for Care, and our trustees of Skills for Care have signed off funding for that for the next 4 years, and that kicked off in December, and we're doing lots of work to support the sector to deliver on the workforce strategy recommendations. Some of those recommendations that are already in progress or have been completed. So as I mentioned earlier, we've got this new care technologist role that we've been exploring. In Scotland, that's been piloted and is now being rolled out more extensively. So we're learning from Scotland, and the National Care Forum are supporting some pilots and some training for that, which is really exciting. They're here today, thank you. We have been working closely with ADAS on some training for new DASs, and in particular looking at their digital maturity, their ability to make digital commissioning choices, etc., digital leadership. Some new e-learning has been published by the Royal Society of Public Health and OHID. and that's on prevention. And the Care Workers charity hosted a focus day on well-being during Professional Care Workers Week, and they're going to make that an annual thing now, which is great. We have revised statutory and mandatory training guide, and what we're trying to do is reduce the amount of sort of burdensome repetitive training and increase the amount of more innovative, more digital skills, more technological training that care workers can get. I mentioned there that commitment from Minister for Care for ramping up dementia training for the adult social care workforce. We are supporting phase 2 of the social care workforce race equality standards, and we have over 80 local authorities signed up to that. And we're working really closely with Newton Europe and other partners, including TSA, on scoping out a project to use AI to improve workforce performance and productivity across local authorities. Some of the changes that we're seeing in practice, I won't go through all of these, but just some really exciting ones. So in the Southwest, all of the ICBs and the local authorities have come together, and they've recognised a really important subgroup for the adult social care workforce strategy, which they're now meeting regularly right across the region, which is great and shows a real commitment. We've got the Staffs and Stoke Social Care Academy pilot, which has been launched using our LMS system. So really looking at how we can use digital learning across a whole patch. And lots of local authorities are working together to map their workforce plans against the National Workforce Strategy. So really ensuring that they're bringing in all of the local initiatives. For example, the People Promise, which we know that health have, but social care doesn't benefit from at the moment. And we've got some areas that are really benefiting from that now. So some key messages that I'll leave you with today. The adult social care sector is already collaborating. We've got the workforce strategy. We've galvanised the sector. That's sort of unheard of in adult social care. It's a really exciting moment, and there's lots of really good will across the sector to make this happen, working as closely as we can with government. The majority of the recommendations and commitments need some kind of support from government, but that means lots of them we can just get on with ourselves. So we're working really hard as a sector to move that forward. We know we're facing challenges. We know we've got lots of reform coming. We've got the Casey review, we've got the National Care Service, etc. The workforce strategy we want to see as a down payment on those things. We want those to be recognised and ready to go. And there's my contact details, so if anyone wants to talk more about the workforce strategy, I'm here. Thank you.
Hi, good afternoon. I'm Julie Stone. As Kevin has already pointed out, I'm a higher education consultant, but also a TSA associated working with TSA on their workforce strategy. We want to shape something responding to the Skills for Care workforce strategy from TSA that is going to be right for the sector, right for your organisation, and right for the individuals who are working in the sector. Jane has articulated very well, let me move the slides on. Jane has articulated very well the challenges that the sector faces. And through the research work that has been undertaken in terms of that workforce strategy, in collaboration with colleagues already from across the sector, there is a strong case for change. And I think I've heard a call for action that we've heard today. But Jane's already, through the strategy, showing and demonstrating the solutions that are being suggested and that change is already taking place. What I take from this report and from other sector documents is this is about transformational change, and that the sector needs to think differently about how it delivers its services if it is to respond to future needs. And I think we all have heard today from all of the sessions that I've been in that we no longer have to argue that technology will be a key enabling factor. It will be a key enabling factor. If we don't change anything, nothing will change. So for every person who is sitting in this room who say, well, we've never done it like that before, we need to keep doing it like this, that will not solve the problems that are down the line that are speeding towards us. Nelson Mandela who back in my higher education days, me and the students often would refer to and about. He stated that education is our greatest weapon for change, and I wholly subscribe to that. But we can't just think about education itself. Paulo Freire, as I'm sure you're all now going, who the hell is he? But he was a Brazilian philosopher and educationalist, said we have to think about the people first. Who are the people who are going to be undertaking this training? What is their background? Where do they come from? And we have to look at that co-design element, because you're going to tell us that, and that's one of the factors that we've got to bring in. But people, our workforce, are our greatest asset, and it is through them that we will move forward and create that change. Jane put this slide up, so I'm reusing it, Jane. But I think those three shifts are really important, because these are three key areas that TSA, as a member organisation, championing the technology-enabled care sector, is well positioned to support and in some instances drive forward. Being in the community, being able to stay at home, moving from analog to digital for those technologies, and moving from a reactive to a preventative part. It's part of the core mission of TSA to see people leaving those gloriously ordinary lives that we hear about for as long as possible in their own homes. So delighted to see there the shifts that the government are looking to achieve. But I'd also like us just to pause and reflect on the three underlining drivers, because as we look at the workforce offer, we also have to take these into consideration. The shape of care is changing, and we've heard just last week from the government that they are really serious about that seamless integration between health and social care, and we've seen that as a significant step. We've also seen the policy change from that reactive to the preventative. And this is going to create more roles and different roles, so that we can see the people within NHS and within this adult social care sector working collectively together and not against each other, understanding each other better. And we need tools that help us to address those aspects. But the shape of work is also really important. Jane highlighted the 540,000 new staff that we need to bring in, alongside the 130,000 plus vacancies that already exist. So we know that the sector is already under strain. The strategy clearly articulates the need for a reform of the roles and careers that are going to take place to address that. But we will need to upskill the existing workforce, but also attract new people into this sector. And part of attracting new people will be 18-year-olds, those young people that we want to see coming in and bringing change and feeding the sector. But these 18-year-olds are a different generation. It's the most diverse population of 18-year-olds that we will have ever seen, most racially diverse, but different in their ways of thinking. They want a work-life balance. They probably won't be slavishly doing the jobs, some of the jobs that we have done. How will we address that? They will be digitive natives, not digital migrants. They'll expect technology to be in place. They'll want to use technology to make changes. Is the sector ready? What do our HR policies look like? What do our learning and development plans look like? And what do our skills policy? But we desperately need these young people if we are to move the sector forward. Sorry, I just need to do one more. The shape of education, the world from which I come from. During the pandemic, we saw that change dramatically. I was responsible for work-based learning. We had over 100,000 students in online learning. We had over 2,000 students in apprenticeship. People are accessing education in different ways. And if we are to upskill the workforce at scale, it has to be in an online modality. We see CPD now is dominated by that. It is consistent, it is scalable, and it can provide access to the workforce at a time and a place that suits them and suits all of the organisation. So all of this is important when we're thinking about what that training and development offer looks like. But also, what's the reputation of TSA? I didn't know. But what I heard in talking to people both internally, more importantly, externally, to some of you that are sitting here today, TSA are a trusted voice. They have an objective view. They have no skin in the game in the same way that other people do. And they have a unique line of sight that nobody else can have in this sector as a membership organisation. For them, enabling people to remain in their own homes is a core purpose for TSA. But for the NHS and for the adult social care, it is now a real need that has to be addressed if we are to meet the needs of that growing, ageing population. But importantly, I think what you would like to see from TSA, at least what I was told, is them sticking to their core competencies, their strengths around this area of provision. And importantly, we need to co-design it together. So, building our future direction. The workforce offer will be in two key areas. It will be around core competencies as part of the quality standard framework, ensuring that consistent approach to workforce development, achieving standards and enhancing quality in core areas such as, call handling, assessing and installation, and responder units. We want to work with you on that, and we've had a team that have been co-designing that. Helen will talk more about that in a moment. But we also need that focus on upskilling of the workforce through tech awareness. If our teams don't know about tech, then how can they prescribe it? How can we put those solutions in? And at the moment, what I heard is there is a gap in the manufacturers of that technology, which is in abundance. We see them here today, but the staff are not aware. They don't have the confidence about that. Technology will always be ahead of where we are on that learning curve of adopting it, but this is something that is absolutely critical to give us that digital mindset. And what I'd like to challenge you to is a digital-first approach. The QSF Core Competency Training will be launched this year as part of the TSA accreditation process, and Helen will talk more about that shortly. But the virtual home has already been rolled out as part of the TSA workforce offer. But what we are now embarking on is to work in collaboration with the sector. So, before we move into looking a little bit more about those offers, we've had 3 shifts required by government. We've had 3 key drivers that are underpinning that we must take into consideration. And I'd like today to tell you the 3 takeaways for TSA who contributed to the workforce strategy. Digital will play a critical role in enhancing the adult social care sector. It will empower the workforce, and what I've heard is it will help to retain the workforce because of the investment in them. Secondly, as well as developing the skills for the existing workforce, how might we prepare for workforces of the future? So TSA are now working on trials with FE colleges and with higher education institutions to look at how we can embed the virtual home either within the curriculum or alongside the curriculum. So when you receive those 18-year-olds into your workforce, hopefully they will be change agents with you. They will have expectations, and we're starting to prepare that critical path. And thirdly, and really importantly, I think, do not know why my slides keep moving on too quickly, but third takeaway is the UCAS Quality Standards Framework is absolutely critical to a sector that requires transformational change, that doesn't have the strong governance in place for that remote care aspect yet, because we need to change to pivot towards standardization of care, regardless of where the person lives or the service provider that they access, leading us to a maturing of the sector and a professionalization of the workforce if we are to realize that change. Okay, so 3 big takeaways there that I think TSA took away from that. So let me talk to you a little bit more about the virtual home. The virtual home is already there. It's a tool that you can access right now. I'm outside on a stand with Helen on the quality stand, and if you want to come and learn more about it, then please do. it has had impact already. Over 5,500 learners have gone through it across 20 plus organisations. The impact already is the tech referrals increased by 30% on average. In some instances, it was by 49%. So we know that this is something that drives those technology referrals. And a survey that we undertook demonstrated that 95% of the people that went through felt more confident as a result to prescribe tech going forward or to discuss that tech possibility. And staff have also used this, authorities have also used this as part of their CQC evidence base to demonstrate, because the CQC are now asking for this, that technology-enhanced care is a rollout of a learning program for their workforces. Okay, so that is the impact so far. I talked about co-design, I talked about co-collaboration, and what's important here is working with you to develop and enhance so these offers remain fit for purpose going forward. We pulled a stakeholder group together from, forgive me if I miss anybody, Beeld, Somerset, Durham, the North East, and we said, tell us about your experience of using this tool. What was really impressive was the range of users that have accessed this. So it really has the reach that we were hoping for. They told us that it would have further impact if we could roll it out for public use and also to students. And they told us as well, I've gone through some of those benefits, but the potential to improve retention of staff because they feel invested in, because they've got greater confidence is absolutely something that we shouldn't underestimate. How did people roll this out? They mandated it, they didn't mandate it. So we can talk to you about all of those experiences, but they built it in as part of their strategy, their 5-year plan for workforce fit for the future. And they did it as part of a culture change. If you don't do it as part of a culture change, then it's not going to be as impactful as you would hope. What were the barriers, we asked? Well, when you have staff changes, particularly staff changes at the top, sometimes you lose momentum and you can lose that adoption and things change in priorities. But I think we will all agree, and we've heard from Jane's workforce strategy, that it really is important that we stick to the thoughts about training and technology-enabled care as a leverage for that. We heard some concerns that if you increase tech, then the budget would increase. But actually, you're investing in the future and you're avoiding a cost of that individual going into the NHS, into hospitalisation, but also losing their independence, which is extremely valuable. So we need to work together to see this as an investment and not as a cost. And at the top of the organisation, really important that the leaders see this and see these benefits. Going forward, as we think about all those different users going through, we've been asked to think more carefully and closely about how we talk to those different users, what their journey through the virtual home might be, and that will be absolutely critical to work with you to enhance that and improve upon that. And as we do that, to look at that enhanced navigation. But data, to me, is power. And as we utilise this, and we utilise this together, we will get data sets out of this that will point us to areas of weakness, areas where we can improve, areas of where we can enhance, and areas of impact. The learning points was to ensure you put measures in place before you set off so that you can measure the impact later. Some of the organisations did this, which is why we're able to talk about the referral rates increasing, but the quality referral rates were really important too. And we've got to keep, being able to talk value for money to be able to say how valuable this is. So we need to get that cost-benefit piece a little bit better. And we need a shift in mindset that it's digital by default. It's not something we fall upon and put in place. I have heard 1 or 2 horror stories today about that, but it's really important that we see this as an investment. And we need to create time for our staff to be able to go through this. Again, if we don't have change, if we don't invest in that space, then nothing will change. And back to that consideration of future workforces. This was something one of the stakeholders said that really resonated with me. They said, you've made me think, if we get an 18-year-old moving into this space and they come into social care as that person perceived it, what will they think? Will it be like stepping back into the 1990s? And we need these digital natives to come with us, to help us, to support us, to take that forward. So that is something that we really need to give some consideration to. I'm really keen that this tool can be utilised for public awareness. So we get families who are telling us, who are informed and can either talk to us about their needs or they can go out and purchase these technology-enabled care solutions for themselves. I see that we'll use it for the existing workforce, that we'll use it for new workforces, and we'll use it to help inform and work with the commissioners and leaders so that they continue to see the importance of technology-enabled care too. I hope when I press this button that this video is going to play, because it's really important. You've listened to me, thank you so much, but what's really important is to listen to the people who've used this tool, and they can tell you more about it and their experience.
The NHS in North East and North Cumbria is delighted to be supporting Virtual House. We've made it available to all our staff across our entire patch. You know, our strategy is better health and wellbeing for all, and within that there's a focus on prevention and supporting people to live well in their own homes. And this tool just makes it really easy for staff to explore how tech-enabled care can help people achieve that in their own home.
When we had an opportunity regionally to jump on the virtual home, we absolutely grabbed it with both hands. Initially, we had our assistive technology team trained on it. Having had some really good feedback from the team, we were then ready to roll it out at a much more wider scale. It's easy to do, it's easy to understand, and key to frontline staff is that they can do it in their own time.
Our team, the Achieving Change Together team, did a walkthrough of the virtual home together in a group supervision, and this was really helpful as a team to discuss the options of assistive tech to come up with new ideas for people we support. So the main benefits of the walkthrough of the home has been really helpful to visualise what assistive technology can be used throughout someone's property and just in the different areas and the rooms of the home. The training really helped to open my eyes as to what's actually available and the possibilities of how assistive tech can be used to support someone to live more independently. I would definitely recommend the Virtual House training tool to others. I think it's great for someone who's maybe wanting to know a little bit more about assistive technology and just to help visualise it in a home setting.
From a TSA perspective, we've really loved being part of this regional programme because it's allowed us to work collaboratively across several local authorities, how they've utilised the virtual home, how they've embedded it within their internal processes, whether that be as mandatory training, whether it's part of their induction for any new colleagues coming into their organisations.
We've had a significant increase in the number of referrals through to the assistive technology team. Not just in numbers though, it's about the quality of those referrals. So when they're out having conversations with people, with families, they're able to talk to them about what some of the technology is that could offer some sort of safety or independence in the home for the people that they care for. We know that CQC are asking now who is trained on the use of assistive technologies. For us, virtual home is key to that. So like I said, we've got 100% or so of our key staff fully trained up to date on the virtual home training modules, so we can just submit that as our evidence base.
Thank you very much. What I'd like to say is when you align all of your regional organisations to work together, that's the impact that you can have. So thank you very much.
Thank you. Everyone hear me okay? Yeah, perfect. Okay, so I'm Helen Loveday. I'm Head of Tech Quality, Head of Quality Improvement for Tech Quality. I just want to give you a quick talk through about what tech quality is, because it gets a bit confusing sometimes. So tech quality is a subsidiary of the TSA. So we manage the auditing scheme for the tech sector. So tech quality has its own governance, it has its own tech quality board, and it's an outcomes-based scheme. So that puts people at the heart of service delivery. It drives quality, it drives safety, continuous improvement and innovation. It's the only UCAS accredited scheme within the tech sector. So it's a really important function in terms of our audit, what we're seeing out there in the sector. So today I'm just going to talk to you about the core competency training that we have started to develop. And we've done this, and we've been addressing this through the tech workforce and through the TSA membership at our surgeries, and we've seen post-COVID that we've seen the effects of a transient workforce, which has led to loss of in-depth tech knowledge. So we've seen where managers, particularly post-COVID, where managers and frontline staff have left the industry, but they've taken that knowledge with them. So what we've been looking at is providing some in-depth competency training as we've gone through this process. So recruitment and the retention of staff has been a challenge, and it's particularly now in a digital world, this is a much more complex world than the analogue world. So through the audit function, we have a really unique position in that our auditors are out there on an annual basis. They're in there looking at operational challenges and the trends that identify the gaps that are in the skills and knowledge within the sector. And so through previous TSA workforce delivery mechanisms and success of previous e-learning modules that we've had in the past, it's been recognised that the flexible learning model was required relevant to a workforce that delivers service often on a shift pattern. And we heard that very much through Julie's presentation when she went through, when we've gone through that process of looking at how best we can service our own staff within the tech sector with that really easy to approach in terms of the training. So our approach has been through collaboration with the tech sector. It's very much been on a training for the sector by the sector. So through our membership events and our surgeries and through the TSA risk register, this has highlighted to our CIRIG programme in June 2024. So CIRIG is our sector risk and innovation group. So they're the people that sit on that committee from the TSA perspective. They're external and internal members, and they respond to operational risks and they oversee the delivery of projects within the TSA. We also, so from them, we have what we call an ICG, an innovation challenge groups, and people sit on a panel, and from there we pull the panel, so we have expert people, so internal and external skill panelists with clear deliverables and time-bound projects. So we work with that innovation challenge group, and they've been key to providing and creating the material for the e-learning. So they've been part of that testing function. They've met on on a monthly basis to make sure that we're on track and kept the programme ready for delivery for the summer of this year. So part of that also in terms of the TSA has been the TQ team. So the key TQ team have taken lots of that knowledge and they put that together in terms of writing the modules and the information that we've used. So in terms of what the value is in terms of that national process and training model that we really want to promote, the deliverables for this was to develop a national tech training model that ensures a national standardised compliance and competency across the sector. So the learning is for frontline staff, it helps them mitigate the risk, and it provides assurance for our managers, our commissioners and our stakeholders of the quality that we have a trained workforce. So we need to invest in our staff training and the professionalisation of tech roles, and this will aid the retention and recruitment of our staff. The learning design approach has been taken from strong academic higher education principles for online learning, and that's where we really see that shift to learning being really up through that e-learning modules. And we aim that this addition is the learning element to the scheme will bring added value to your organisation and to your staff. So the alignment with in terms of the process and what this looks like as we roll forwards is it will be on a 4-year programme. It will align with the Quality Standards Framework audit for certified organisations, and each organisation will have access to the learning for a 1-year period, and that will align with their audit as we go forwards. So each programme will be reviewed to move with tech changes and challenges within the industry, and that's really important now. As we see, the tech is moving at pace. You will see that the changes need to be much more reviewed and updated in that e-learning modules. So we've committed to doing that on an annual basis, so the programmes will shift, and some of that material will stay the same because it's fundamental to the service that the frontline delivery does, but some of it will change as we've introduced new processes. So who is this for? This is for the organisations that are QSF certified that complete the 3 service delivery modules, so that's tech monitoring, assessment, installation and maintenance of tech, and our tech responder service. The modules are sitting on a really easy to use e-learning platform, so the managers have control of that. They can onboard their staff onto that portal. They can oversee their staff as they go through their journey on those 3 modules. There's clear learning outcomes, so exactly what they need to learn from the beginning, which is backed up at the end to make sure that they've understood the content within the module, and there's the clear learning outcomes at the end. And there's knowledge checks throughout that e-learning to reinforce the learning. At the end, there's a module assessment. So at the end of each of those modules, there'll be an assessment to test the competency from a bank of questions. So those questions will rotate. So if they fail the first time, they won't have access to the same bank of questions the second time. But it's a positive way. This is about supporting our frontline staff to have that skills and knowledge to complete their role. And it's aligned with the Quality Standards framework. So reporting function for managers will help them to see their staff, how they're completing that, if they need additional help and support along their journey. And it will also help with the auditing perspective, so you'll be able to raise that report directly from that portal as evidence for your auditor when they come to that audit. So, in terms of updates to the Quality Standards Framework, we will be updating some of the governance within the Quality Standards Framework. So that's updating the Tech Quality Handbook. And there will also be additions to the criteria into the scheme. So in September and October 2025, as the training goes live in June, so we will update the criteria within the Quality Standards Framework. And in the first year, you'll find that your staff are working towards all the frontline staff, but this is a mandatory requirement. We'll want to be able to see that programme of learning on a year-on-year basis for your organisation and for your staff. And in the second, in 2026, it's a case of all frontline staff must complete the relevant programme. So you will have had a year's worth of programme in there. Organisation will find them probably into their second year in terms of 2026. So in terms of our next steps, like I said, the training will go live in June 2025. There's a demonstration of the modules. So if you want to, in the reception area as you come up, on the left-hand side, you'll see our TSA Tech Quality stand. They've got the laptops there, so we can give you a little demo of what the training looks like. It's really a variety of learning methods. So there's some speech, there's some little activities that they complete. There's some learning, some narrative on there as well. So it's quite a nice way and a nice flow through the modules for people to understand the training and learn in different ways. So our TQ staff are available to support you. So if you haven't had if you're certified and haven't had a one-on-one meeting with us, then by all means contact myself or Chris. We are working through everybody to make sure everybody understands how this aligns with their QSF audit. We will complete a train the trainer session, probably around May time, so that managers can understand how they onboard their staff. Like I said, you've got control of that, so it's really simple to do and to trace your organisations. And CIRIG will close for phase 1. So these 3 core modules will be phase 1, but we will be going into phase 2. Phase 2 takes us into fire. So fire is a huge subject, and it's a very changeable subject. There's a lot of standards that sit behind fire. So we will bring that together as one module. It will cover all those 3 elements of the service delivery modules, but it will be specifically for fire. And we'll work with our colleagues in the NFCC to help deliver that, and people that sit on the ICP panel. So if that's something that you feel that you're interested in, by all means contact the TSA and contact myself or Alan Williamson, who heads up taking all those people that want to come onto the ICP, because this is about you and the frontline staff. So you're the ones that really help us to write the material so it's really relevant for your staff. So I'm just going to show you a short video message from our chair and our CEO of Tech Quality.
Hi, I'm Alison Scurfield, the Chief Executive of TSA. I'm also the Chief Executive of our subsidiary, Tech Quality. We have a shared vision of people's lives being enriched and enhanced by tech-enabled care.
My name is David Pearson, and I'm the Chair of Tech Quality, which has the only externally accredited quality standards framework for technology-enabled care in the UK. I also lead and support other initiatives in social care and health, including a national adult social care workforce strategy.
We are launching our new training modules, which will be embedded into our quality standards framework. This will be mandatory for staff who work in the technology-enabled care sector to ensure that they have the right skills, the right capabilities, the right knowledge to deliver those services safely in the community. This is really enhancing our quality standards framework to not only look at quality and safety, but that continuous improvement of our workforce.
By investing the time in the training and development of your staff, this can make a huge difference to the people we serve.
I can't hear it, so hopefully that's the end of that bit. Okay, so just before we move on then, I'd just like to say thank you. We couldn't do this without our CIRIG and particularly our ICG members who helped us over the last 6 months to develop and create the material. We also would like to say thank you to our testing partners, because this went out to organisations for our frontline staff to test the modules as well. So, and again, without them and their feedback, we wouldn't have the material that we have now. So I really do hope that you find time to spend at least 10 or 20 minutes in our foyer and just have a look at the training modules and just have a look at the sort of quality that we have in there and how this is really going to help and benefit our frontline staff for the future. Thank you very much.
Okay, guys, thank you very much. I think I'm right in saying, Helen, that's a world premiere for that video, and we've one of the stars in the audience with us. So there's autographs available later if you're really signed up for it. So there is time for some questions. There's a lot of content covered there, but I'm looking and scanning for those who are really nervous or really keen, or don't need to learn anymore. Okay, well, I have a question. And I think I'm going to ask you, Jane. There's obviously a clear case for investment in workforce. But at the same time, we keep hearing there's no money in the sector for this. So how can we afford everything that we've heard about today?
That's it. Hit me with the money question straight away. Thanks for that, Kevin. No, you're absolutely right. There is no money in the sector. What we did when we developed the workforce strategy was try as hard as possible to make recommendations low or no cost where we could. We did quite a lot of economic modelling, and the most expensive bits were things like pay. But the government is addressing pay through the Fair Pay Agreement for adult social care at the moment, so we see that sitting outside of the workforce strategy. But we believe really strongly that if we work together as a sector, bringing in partners like the TSA and other organisations, we can afford a lot of these changes, and we can do these things together, and we can do these things really efficiently and productively. Obviously everything costs, but we think if we work together and kind of galvanise and pull things through existing routes and resources, we can make a difference. So it's about being positive and optimistic with the very small budgets that we have in social care.
Okay, I think we have a question. If I could just ask the questioner to say who they are and what organisation they represent. Helen?
Yeah, you can. Hi, everybody. My name is Helen White. I'm Chief Exec of Taff Housing Association, but also a Non-Exec Director of Tech Quality. So it's been great to see the organisation grow over the last 4 or 5 years, and really proud of what's been achieved through Helen and the team. So brilliant job, well done. The question is about the changes to, or the impact of the national insurance increase for particularly third sector providers. And are you hearing any kind of concerning messages that organisations are thinking this may have a direct impact on what they want to invest in training? And wouldn't that be a sort of sad output or outcome of that? And how can we mitigate it? Thanks.
Okay, that's an even more difficult question. Who wants to take that?
Do you want to take?
Yeah, happy to have a go at that, Helen. I think that we are hearing there's no money in the sector, but I think and I'm sure the national insurance contribution is part of that. I think it's been more difficult. What we're hearing, it's more difficult for organisations this year than it has been before, and so we're really conscious of what we roll out has to be a sector approach, and it has to be as efficient as possible. And between us, as we've talked to Jane about, collaboration, it stops us all spending individual little pots of money that actually, if we're pulled together, we can see a much more efficient and effective way of doing it. But that requires us to work together. And I don't throw the words co-design around loosely. I really mean that we have to understand what the need is. That's the sector to tell us, and then we design it appropriately. But I think you're right, Helen. I think it does feel, I've only just come into the sector, but I'm hearing people say it's far tighter this year than it has been previously.
Helen.
Yeah, I think I'd just build on that as well, because it is about mitigating risk within the sector. So if by investing in the training, by investing and ensuring that your staff are trained, they're going to deliver better for the organisation. And then ultimately that means we're offering a quality and safer service for those people that are out there that we serve. My role in Tech Quality is often I'm unfortunately have to look at coroner's court cases where things have gone wrong and have to unpick that and understand where that's gone wrong. And quite often it's not always, but QSS, staff that are not QSS certified, that haven't gone through a robust training, that are not monitored, they sort of fall out. And that's the unfortunate side of what I do is in my role is to look at, someone has died because the service hasn't been there, the quality of service isn't there, the safety of that service. So by investing, although this is a small amount of money to invest in your workforce, actually in a wider picture, there's no price on people dying out there, and there's no price in making sure that your staff feel confident in their role when they're out there dealing with people in the frontline workforce. And I think that is a massive investment in terms of supporting your staff, and it's not always about money.
Okay. Well said. I think I'm hearing we can't afford not to. Is my short pressing of that, yeah. Anybody else with a question, burning question? No? Helen, one last question from me. It's going to be mandatory for QSF certified organisations, but what if you're not QSF certified? Can you access this resource?
Not at the moment, because the actual training aligns with the Quality Standards Framework audit. So the whole process is that you have robust processes in place as an organisational point, and then the training sits alongside that. So it means that your staff, whether you're a manager or frontline staff, they are aware of those robust policies, and that they're fully aligned with the Quality Standards Framework and the criteria that sits beside that. Obviously, if people want to become QSF certified, they will then get access to that material. So we're more than welcome to take those conversations, and we can happily meet with them on a one-on-one basis and talk you through the process of going on your QSF journey. We also have a QSF journey group tomorrow at 1 o'clock in the media suite. So if anybody is interested in joining that group, again, come and speak to us, and we can direct you into the right place to hear about how you start your journey, and then you'll have access to that training. We have lots of tools and guidance within the Quality Standards Framework in the Tech Quality side, so everything aligns to those tools, and that includes the training.
So the journey to the QSF accreditation is a learning experience in itself.
It is.
It's a journey. Okay. Okay, folks, well, thank you very much for your attendance and attention, and thank you very much to our esteemed speakers today for sharing their insight and wisdom.
Thank you.